Hello, my topic is Ledipasvir and Sofosbuvir for previously treated HCV genotype 1 infection. Definition: Hepatitis C is a viral infection that causes inflammation of the liver, which sometimes leads to severe liver damage.
If you have hepatitis C, your liver is inflamed because you have been infected with hepatitis C virus. Your liver is the largest organ inside your body and performs many important functions. The functional parts of your liver are called hepatic lobules. Your hepatic lobules filter all of the blood in your body. As your blood passes through them, your hepatic lobules break down harmful substances, remove bacteria and worn-out blood cells, and form clotting factors that control bleeding. After a meal, your liver makes and stores nutrients to provide your body with energy when needed. Your liver also makes a substance called bile. Your gallbladder stores the bile and releases it into your small intestine to help digest fats in the food you eat. If you have hepatitis C, the virus entered your body when you were exposed to the blood or other body fluids from a person infected with the virus. This could have happened from sharing a drug syringe with an infected person. Other ways you may have been exposed to the virus include having sex with someone infected by the virus, sharing personal hygiene items such as razors or toothbrushes used by an infected person, direct contact with the blood or body fluids of an infected person, or when a mother passes it to her baby during birth. During the early or acute phase of a hepatitis C infection, the hepatitis C virus enters your liver and invades your liver cells. Once inside your liver cells, the virus begins to make copies of itself. During the copying process, changes called mutations occur frequently in the virus's genetic material, leading to new strains of the virus. In response to the viral infection, your body sends immune cells to attack both the virus and the liver cells infected with the virus. As a result, these liver cells become inflamed and then die. Over time, scar tissue forms around dead and infected liver cells. The scar tissue prevents your liver from working properly. If you have a chronic hepatitis C infection, your liver contains a large amount of scar tissue called cirrhosis, which limits blood flow and results in permanent shrinking and hardening of your liver. A vaccine contains weakened or inactive viruses that train your immune system to recognize and attack certain viruses. However, frequent mutations in the hepatitis C virus make it likely that you will catch a version of the virus not contained in a vaccine. As a result, there is no effective vaccine for the hepatitis C virus. If you have hepatitis C, your immune system alone may destroy all of the hepatitis C viruses in your body. However, most people infected with the virus develop chronic hepatitis C, a condition in which your immune system is not able to destroy all of the viruses in your body after 6 months. If you have chronic hepatitis C and your immune system can't get rid of the virus completely, your doctor may prescribe a combination therapy consisting of an antiviral medication called ribavirin and injections of interferon, a medication that strengthens your immune system. These drugs are most effective against hepatitis C when taken together. If you have a severe case of chronic hepatitis C, your doctor may recommend a liver transplant operation.
Sofosbuvir is in a class of antiviral medication called nucleoside polymerase inhibitors. It works by decreasing the amount of hepatitis C virus HCV in the body. Ledipasvir is in a class of antiviral medication called HCV INA5A inhibitors. It works by stopping the virus that causes hepatitis C from spreading inside the body.
Chronic hepatitis C virus infection, or HCV, causes progressive liver fibrosis, which can lead to cirrhosis and hepatocellular carcinoma. An oral regimen that would treat patients infected with many of the possible viral genotypes was tested in this Phase 3 double-blind placebo-controlled trial. Treatment-naive and previously treated patients with HCV were enrolled at multiple sites in the United States, Canada, Europe, and Hong Kong. All of the patients were chronically infected with HCV 1, 2, 4, 5, or 6. Patients with and patients without compensated cirrhosis were included. Study participants received one tablet daily containing either Sofosbuvir and Ledipasvir or placebo for 12 weeks. The primary endpoint was a sustained virologic response 12 weeks after the end of therapy. Of the 624 patients who received Sofosbuvir Ledipasvir, 99% had a sustained virologic response. None of the patients given placebo had a sustained virologic response. 15 patients who received Sofosbuvir Ledipasvir had serious adverse events. The most common adverse events were headache, fatigue, nasopharyngitis, and nausea. The authors conclude that once-daily Sofosbuvir Ledipasvir for 12 weeks provided high rates of sustained virologic response in treatment-naive and previously treated patients who were chronically infected with HCV 1, 2, 4, 5, or 6, including those with compensated cirrhosis. Full trial results are available at nejm.org.
Application in nursing. Explain to family members and the patient the importance of physical rest and verify complaints. Regarding the diet, it must be normal fat, normal protein, and calorie. Take Ledipasvir and Sofosbuvir are around the same time every day. Take orally. The duration of treatment 8 to 24 weeks depends on your kinship. Pros and cons. Pros. Ledipasvir and Sofosbuvir is a combination medicine used to treat chronic hepatitis C in adults and children who are less than 3 years old. Takes a specific genotype of hepatitis. Cons. If you have ever had hepatitis B, the use of Ledipasvir and Sofosbuvir can make this virus become active or worse. You will have frequent blood tests to check your liver function.
Sofosbuvir plus Ledipasvir. Sofosbuvir plus Ledipasvir is a medicine used for the treatment of hepatitis C. The trade name of Sofosbuvir plus Ledipasvir. Mechanism of action of Sofosbuvir plus Ledipasvir. Antiviral of direct action. Therapeutic indications, uses and benefits of Sofosbuvir plus Ledipasvir. Treatment of chronic hepatitis C, HCC, in adults and adolescents from 12 to 18 years old. Dosage of Sofosbuvir plus Ledipasvir. Sofosbuvir/Ledipasvir. Oral. Adults and adolescents 12 to 18 years old, 490ths of a milligram, 1 time/day with or without food. Mode of administration of Sofosbuvir plus Ledipasvir. Oral use. Swallow the tablet whole, with or without food. Do not chew or crush the tablet. Contraindications with Sofosbuvir plus Ledipasvir. Hypersensitivity, concomitant administration with rosuvastatin, used with potent inducers of intestinal glycoprotein P, rifampin, rifabutin, St. John's wort, carbamazepine, phenobarbital, and phenytoin. Warnings and precautions with Sofosbuvir plus Ledipasvir. Do not administer concomitantly with other medications containing Sofosbuvir. Limited data in HCV-infected patients. Not recommended in children and adolescents under 12 years of age. No safety and efficacy data. Risk of severe bradycardia and heart block in concomitant treatment with amiodarone. Risk of symptomatic hypoglycemia in diabetics. Caution in severe renal failure. Side effects of Sofosbuvir plus Ledipasvir. Headache, rash, fatigue. Please subscribe to the channel to continue uploading videos. Thank you.
I should apply it in Ecuador. The Ledipasvir and Sofosbuvir combination therapy showed a sustained biological response SVR rate of 99% in treatment-naive patients. The rate of SVR was 94% to 99% in treatment experienced patients, while in cirrhotic patients, the rate of SVR was 86% to 99%. The treatment response was not affected by ethnicity or just genetic factor. Conclusion. Hepatitis C has become an increasingly year-long health concern throughout the world. Even since its discovery with dauntless effort to find a cure, this virus has proved to become an epidemic example of emerging pathogen sweeping our globe. While symptoms may go overlooked by countless and suspected weeks, one should always routinely check with a physician. If there is at all any suspicion of this disease, there are several tests that can be performed. Avoiding any contact with ailments that may have black on them should always be taken with the utmost precaution.
HCV is a linear single-stranded RNA virus whose genome encodes a single polyprotein of 3,000 amino acids. The protein is then processed by both host and viral proteases into structural proteins and non-structural proteins that assist in viral replication. Several steps are fundamental for HCV to infect a cell, replicate, and then release to infect other cells. Each of these steps is a potential target to interrupt replication, rendering this virus inactive. The HCV RNA is surrounded by an icosahedral shell of protein, which is then surrounded by a lipid envelope made from modified host cell membrane. Although the exact mechanisms of HCV cell entry are still unknown, it's thought that the envelope proteins on the surface of the virus bind to host CD81 and other cellular molecules, allowing HCV internalization. Once bound, HCV is internalized through endocytosis. The plasma membrane folds inward, bringing HCV into the cell. HCV travels through the cell cytoplasm to the rough endoplasmic reticulum. Ribosomal subunits associated with the RER serve as translation units, converting the message coded in the mRNA to a specific sequence of amino acids, the HCV polyprotein. Translation of the HCV genome results in a large polyprotein that is then cleaved by host and viral proteases to produce 10 viral proteins, 3 structural proteins used to assemble new viral particles, and 6 non-structural proteins which support viral RNA replication. Inhibition of the NS3 protease severely compromises NS protein processing, RNA replication, and viral assembly. The enzyme is a target of a highly anticipated protease inhibitors currently in clinical trials. Although designing an inhibitor was difficult due to the shallow substrate binding groove on NS3, 2 compounds, Ledipasvir and Sofosbuvir, are now currently available for use. The non-structural proteins NS3 and S5b facilitate HCV RNA replication, first by assembling the membrane-associated replication complex responsible for synthesizing RNA, and then by recruiting the genomic RNA into the complex. Although all the NS proteins are essential for replication, the NS5b protein encodes the RNA-dependent RNA polymerase responsible for RNA synthesis. Although the actual function of NS5a remains vague, it is vital to the replication process, and agents that target this protein inhibit HCV. Since NS5b is responsible for synthesis of both the negative strand RNA intermediate template and the positive strand genomic RNA, it has emerged as a natural therapeutic target. Several HCV polymerase inhibitors are in development. These direct-acting antiviral drugs can be either nucleoside or non-nucleoside inhibitors. Nucleoside inhibitors are analogs of their natural substrates. The polymerase attempts to incorporate the analog into the growing RNA chain, resulting in chain termination and binding of the enzyme's active site. It is thought that resistance will be uncommon with these agents, as they incapacitate the active site. Non-nucleoside inhibitors achieve the same effect by binding directly to the enzyme, causing conformational changes in the polymerase. Drug resistance is more common in NNIs, as they bind areas distant to the active site. Several polymerase inhibitors have been developed and are advancing through the clinical trial process. All of these have demonstrated excellent short-term antiviral activity. Viral life cycle are poorly understood. The virus is signaled to switch from replication mode to assembly mode. This may be triggered by phosphorylation of NS5a. Nucleocapsid assembly involves packing genomic RNA in the icosahedral shell of protein, then surrounding the structure with a lipid envelope made from modified host cell membrane.